Melody West. I'm a registered occupational therapist, and I have been contacting folks for a long time, and most all the vendors around the city know me because I'm a patient advocate. I feel like their equipment should be the patient's need, and that's my bottom line here. At the present time, I'm doing work for a select rehab in a long-term care facility in Greentown, Benchmark, and I also do some PR work for Kindred, which is an outfit that specializes in vets and wounds. I want to support some of the things I've already heard. The knowledge level is very important in providing equipment to different patients. Different patients have different risks than other ones. I'll give you some examples, particularly patients with spinal cord injuries, CPNS, spina bifida. Those types of patients do not have sensation, and it's very important that they have fitting of a proper chair and be sure they get offloading, and they need to be followed to be sure if they call up and say, there's something wrong with my cushion, you need somebody local to go out right away before they get a DQ, and which if they need to have a flap done, we're probably talking about $300,000 or more. And they go to the acute hospital, they go to them, they have surgery, they have a lot of antibiotics and so on. It's very important there's different risk levels. Sometimes, like not everybody's the same. At the same time, I would admit I have a patient that has Parkinson's that can walk short distance with a cane, and she just recently, within the last month, received a power chair, which happens to be a $25,000 tilted space, which I was not involved with that. Of course, a bidder was involved with that. They used her diagnosis and so on to qualify her for that, but she probably, in her little apartment, having a little scooter or just a smaller power chair, she could have gotten around in her little apartment better than this kind of big machine that she now has. So knowledge is very important to match the patients with the needs that they have. Also, I hadn't really thought about this thing about the rural, but they brought out the rural. I did have a patient that they dug out of the rubble in Joplin, and when there was an attempt to use a vendor which he wanted, he couldn't do that. He had to go to this other vendor, which he, let's just say, if he hadn't heard the complaints, then he told me that he talked to several people in that company, and I'm not going to repeat some things he said to me because he was very upset. And he also said that he contacted Medicare and talked to them about what he felt like he basically needed. And so it was quite some time before he got a replacement chair. Anyway, for the sake, if you want to hear complaints, he probably would tell you, that type of thing. And just, one of the big things I just want to reiterate, is I am very supportive of having local vendors because they're able to provide service to the patients. You usually get them to get a chair someplace in the future, particularly if our quality is going down, they're going to need some service for their chair. Even if it's just a little manual chair. And they need somebody local. You are talking about people, these aren't, these people have immobility issues, all of them, or they wouldn't be having chairs, walkers, canes, and so on. So I feel like that is a vital thing to provide, just basic service for the patient over the long haul, because it's on the long haul where the risk is to end up back in the hospital and impact the system. It's hard on the patient, and it's not good on our system either. Do you have any questions? Go for it. Okay. Thank you. Thank you very much.